Well, it is not easy to follow Dr. Karyang, and he always have passion, and he need 8 hours, I only need 10 minutes. So this is my disclosure. We were informed to leave the slides at least for a few seconds. So we're gonna mention about the penile implant for sure. The loss of penile length after removal of infected implant is a reality. I'm sure nobody would disagree with this in this room. Yesterday there's a debate about the penile length after the penile implant, but this one I'm sure everybody will agree. During the last consultation in Madrid, and we know that after the infected penile implant is removed, there is about 4.6 centimeter loss of the penile size when you redo the surgery. So there's something we can do. There's some kind of strategy we can use. And the most desirable maneuver is the immediate salvage procedure. The second one is called a carry-on cast. I will quickly mention about. And the least desirable procedure we can do is a delayed reimplant. However, this is the most common thing we do on daily practice. So what do we do for the immediate salvage? I'm not here to talk about how to do the salvage procedure. What I'm talking about is the size preservation. So this study clearly showed that if the patient received the salvage procedure and compared to patient has delayed reimplant, the loss of the penile size is a big difference. There's a big difference. So salvage procedure has about 0.6 centimeter loss of the penile length and versus 3.7 centimeter loss of the penile length with delayed reimplantation. Unfortunately, only 17.3% of the people will receive the immediate salvage procedure. So what happens if you cannot do the immediate salvage procedure? For example, the patient failed immediate salvage or patient are very sick. So what you can do, and the famous Karyang has reported his cast. What is this cast? It's a stimulant and contain the calcium sulfate, and which is commonly used in orthopedic surgery and dentistry. And he reported his case theory, I don't know, a few years ago. And what happened was that if you use this method, the loss of the penile length is only about 1.1 centimeter compared to the history of more than 3.6 or 4 centimeter penile length loss. And the penile length can be maintained in about 95%. And the most common procedure we do, no matter what, is going to be the delayed reimplantation. More than 80% of the people will get that after the penile implant get infected. So if we do the delayed reimplantation, there's a couple of things we can do. We can do something before surgery, we can do something during the surgery, and we can do something after the surgery. So before surgery, the first thing you can consider to use is either a vacuum pump or traction device. So this is the consultation we just finished not long ago, that there's two study. One is a randomized control trial, the last one is case survey. So if you have patient use the vacuum erectile device before the implant, the patient can have about 1 centimeter increase of penile size. Also, if the patient has fibrosis, then the patient can have soft, the fibrosis can be soft, become softened, and also dilatation would be much easier. And also, if you have a penile implant already, when you use a vacuum pump and combined with the vacuum pump, some patients will report increased penile size and rigidity. And this is example when you start to use the vacuum pump before the penile implant. You can see from the beginning to 7 weeks, there is about 2 or 3 centimeter increase of the penile length. And what about the traction device? Dr. Levan reported a case survey a few years ago, and including the patient has a penile implant removed before. So when you use this traction device, there is a pretty good possibility not only preserve the penile size, but also can have improved the patient satisfaction. And we do not have any information at this point about a second generation of the vacuum device. I'm sure the data will come in the years to come. So what about the surgery we can do during the procedure? We can do vansilophylloplasty and we can do shears. Vansilophylloplasty, we can do suprapubic fat excision, which was mentioned by famous Jerry Brock yesterday. And also we can consider sliding technique, which is a procedure many people are against. So this is a very simple picture about the final vansilophylloplasty. You can excise the penile-scrotal web, and about 84% of the people report the perceived increase of the penile length. And this surgery can be done through a ventral incision and then through a transverse incision, and you can close vertically and also can show a perceived increase of the penile length. So Osama shares from Egypt. He reported his technique through the penile-scrotal incision. He can access the pubic skin and attach the pubic skin to the pubic symphysis to improve functional penile length. That's another procedure we can consider to perform. And for the patient, especially in America, we have a lot of people with significant prepubic fat. And this, when you do the penile implant surgery, especially for the redo procedure, you can consider to do the fat removal at the same time for the penile implant. And the sliding technique is reported in 2012. And the Ingegio from Brazil was the one really popularized this procedure. He did multiple modification, and he has the largest theory of the patients through this procedure. And basically, he reported that a patient can have about 3.1 centimeter increase of the penile length. The major problem is the gland necrosis, which is a complication everybody are afraid of it. So I started to do this sliding technique about a few years ago. Basically, I tried my best to keep the continuity of the glands with the skin dartos and the neurovascular bundle. So I use this extended ventral penile incision to perform this procedure. And luckily, so far, we have not get any body has a gland necrosis. When you do this procedure, you can basically not only to remove the scar, you can also remove the plaque with a calcified plaque. However, SMSNA has issued a position statement about this procedure. This procedure can only be done by experienced surgeon. I know that in this room probably very few people, if any, will do this procedure, and I agree with you, probably it's not a good idea to do it if you don't feel comfortable. And also, if you do this procedure, this should be done under the research setting, and I also agree with that. And so you have to have a very long communication with the patient if you are planning to do this. And another thing we can do is delayed reimplant. And for the delayed implant, we can do the post-IPP rehabilitation. And we published our paper a few years ago. It's a multi-center study. Basically, we have the patient to start the cycle, the implant 6 weeks after the procedure. If you look at the 6 months, 12 months, even 2 years, there is a potential increase of the penile length. However, this study are not done for the patient who has infected penile implant removed for reimplantation. These are the virgin cases. However, we can use this concept to adapt to the patient has the infection of penile implant for reimplantation later. And the last thing we can do, if the patient had a salvage procedure, which is very common in this country, we use a malleable penile implant to do the salvage procedure. You can consider switch to the inflatable penile prosthesis. Also, if the patient has significant fibrosis, when you did the surgery with downsized the cylinder, you can consider upsize. And Dr. Gross reported a case study about 54 patients with infection, 58 patients with infection and with one-to-one salvage procedure. And about 31% of those patients had mandible replaced with inflatable device. Unfortunately, I could not find any data regarding the size and the satisfaction. I'm sure we should look at this information in the future. And Dr. Wilson proposed the procedure is that upsize the cylinder if the patient used the narrow base or 6R, and a few months later, for example, 8 to 12 months later, you can bring the patient back, put a larger, longer cylinder. So this is my last slide recap. For the size, purpose, we can consider immediate salvage, which is the most desirable procedure. If not, we can do the bridge procedure, which is a current cast. And if we have to do the reimplantation in the delayed fashion, there's some procedure we can consider as well. Thank you so much for your attention.